it hit really fast. I mean, it was just like, wow.
Unprecedented.
A global disease for which we really had no information.
Tremendous stressors.
Our pediatricians were drowning.
Lots of burnout.
Children just lost. Fear of not knowing what was going to happen next.
We're in crisis mode.
The COVID-19 pandemic swept across the world in early 2020, uprooting every aspect of how we live. Throughout it all, the American Academy of Pediatrics was laser focused on keeping infants, children, teens, and young adults healthy and safe.
It was amazing how the AAP stood up and took the lead.
The way that the American Academy of Pediatrics approaches any topic is to ask two central questions. What do children need, and what do pediatricians need in order to take care of them? And those were the two questions that drove us through every aspect of this pandemic.
And so we gathered all of our experts, especially our infectious disease experts, and anybody else we needed to come into the picture to get this guidance out. It evolved from just how do you take care of people with COVID, how do you run your office, to what to do about getting back to school, wearing masks. It was a whole gamut of information that we gave out. And we did review it every 4 weeks at a minimum, and we updated it many, many times.
As the pandemic continued, the language of case counts and infections, hospitalizations, and deaths spread as well.
Our data teams, our amazing data teams here at the Academy and our leaders across the country began to look at this, and they said, there's no place we can go to see what the impact is specifically on children.
So we gathered data from around the country, and week after week after week told the whole world what was happening to children in the pandemic.
And very quickly it became clear that we were really the only ones doing this, I mean, essentially.
And so without the Academy of Pediatrics, I think the whole story of children in the pandemic would have gone absent.
Physicians, nurses, and others in healthcare worked tirelessly to keep families and children safe. At the same time, they had to balance taking care of themselves, their families, and their colleagues.
The pandemic really taught us as healthcare professionals how vulnerable we really are in taking care of patients who might be sick with an illness for which we didn't really have answers, and we didn't understand exactly how this disease might impact not only the patient, but our own workforce, ourselves, and our families.
There were moments of real inspiration where people stepped forward in ways that were totally unexpected and that we didn't know that we needed. One of the stories that I remember is of a pediatric emergency room physician who was going into the hospital every day to take care of adults. It was unclear what her risk was for COVID. And so in order to protect her family, she slept every night in the garage. And she did that for a very long time. That's the kind of story that was routine in this pandemic.
Some of our pediatricians in particular, depending on where they practiced, they were hearing a lot of anger from families and from their communities. And so to let them know that we've got your back, we know this is really hard. We're doing everything we can at all levels to help support you and help make this better. It was really important to us to do that.
We worked hard on the PPP loan and making sure that pediatricians were included in that, and also the other money for healthcare. And initially that was not, pediatricians weren't included in that because it went to people that took Medicare. And so there was a lot of behind the scenes things that went on so that people that took Medicaid could get that money as well.
In 2021, our members watched health officials approve the vaccine for adults, then teens, then finally the youngest of our population. The challenges of COVID-19 were not to be forgotten, as contagious new variants like Delta and Omicron stressed the hospital system.
I think there were two things that we tried to do as AAP and that I tried to do as president. First was to really make sure people had the information and the tools they needed to respond. We also at the same time really advocated for them. I mean, we were out at the federal government, we were talking to state governments, we were talking to the media, we were talking to anyone who would listen, to let them know that, and to really push for things that would help pediatricians to be able to provide the best care that they could.
While the wait for the vaccine was day by day and month by month, this amazing scientific and medical accomplishment was 40 years in the making.
The rollout of vaccines for children and for the public in general was first of its kind. What really helped us, however, is that we all in our field, in my field in particular, understand how vaccines work. We understand what the FDA and CDC process is for approving and guiding the use of these vaccines.
What a miracle these vaccines were. The mRNA technology had been in development for 40 years. And this just happened to be available and ready to go when the pandemic hit. We were so fortunate. And to me, that was, I say it's a miracle, which makes it sound like magic, but it was really a miracle of timing that it was ready to go.
A really important piece was ensuring that as the vaccine was available, it was also available to everybody, and that access to the vaccine was available in an equitable way.
The American Academy of Pediatrics has always been a trusted source, and I think it continued to be a trusted source, but there were also other competing sources of information that sometimes confused our public, and we need to be more careful about how we can continue to really be one of those trusted sources that represent thousands of very skilled healthcare providers, epidemiologists, practitioners, researchers, and policymakers.
On October 19, 2021, we declared a national emergency in child and adolescent mental health, the first time in our history when we've taken such a step. This parallel crisis wasn't new, but built dramatically over the pandemic to a critical need that deserved new attention.
Increasingly, we would see these comments from pediatricians saying, I'm seeing more kids with mental health concerns and ear infections. I spend half my day taking care of children with mental health concerns, more than I ever have before.
We have 50% increase in ED visits for depression among teenage girls. Suicidality increased, levels of anxiety, which were already very high in kids. And then the pandemic hit and it really soared. When kids don't have hope, when adults don't have hope, it changes their emotional well-being.
We ultimately end up working with the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association and put forward this declaration.
This was the first time the American Academy of Pediatrics ever took it upon themselves to declare a national emergency on some aspect of child health.
What we saw was an increased attention to the issue. We saw increased federal investments. We saw a lot of changes begin to happen.
Going into 2022, communities sought to give kids the routines they thrive on. But safety measures designed to keep kids safe from the COVID-19 virus were a big challenge.
I'm a grandmother. When the pandemic started, my grandchildren were 6 and 4. I watched as every parent and grandparent did in the country. Schools and childcare just shut down and went away. We always took the stand that children should be back in school, back in childcare, back in their routines as soon as it's safe to do so. So there ended up being a lot of strife, which I think was not good for our children. I often reflect back and think we would have been so much better off if as a country we could have kind of come together and all agreed this is what we need to do for children.
The pandemic exposed inequities in healthcare for children that have been festering for a long time. The racial justice protests in 2020 forced everyone, including the AAP, to take a deep look at how to combat racism and inequality.
One of the most important things that we learned during the COVID pandemic was it was about the inequities that exist not only in our country but all around the world in the way that individuals have access to good health and good health outcomes.
With officials declaring an end to the emergency phase of the pandemic, how are children doing now?
Kids have been through a lot over the past few years, and I think it depends how they're doing now. I think some kids are doing better, right? They've got some good stability, and they learned over the past few years, and they're starting to do better. I think some are really still struggling. The impacts of the trauma of the past few years have been profound.
Really realize that there are children who missed a lot of school and they're behind, and to get them to caught up is hard. Yeah. There are children who suffered more mental health issues, especially with family loss. They lost family members, and so I think we're still in that process of recovery, and children are better than they were in 2020 and 2021.
I think so.
But we still have a long way to go.
We do.
We say all the time that children are not small adults, and that's true. You can't fit children and families into an adult system. So as we think about rebuilding the things that were harmed during COVID-19, public health systems, community services, the whole pediatrics healthcare capacity, we've got to strengthen those. And then as we think about future pandemics or respiratory viruses, we need to remember that we have to start with the children. If we get it right for children and families at the beginning, we'll get it right for everybody else.